Hey people, welcome to episode 246 of the Sports Therapy Association podcast. My name is Matt Phillips, creator of OneChatLive.com, and as always, this episode is being recorded live 8 o'clock Tuesday on the Sports Therapy Association YouTube channel, except that it's not, because this is a re-record, as we had internet connection issues in the live version. So my guest, Cecily Hislop of South Phoenix Massage Therapy, has kindly agreed to get together with me once more so we can get this very important episode out to you. And that's just the way we roll at Sports Therapy Association. We can't deliver something that's sub-quality. So yeah, we're re-recording it. So there's not a live lounge at the moment. There's nobody here to ask questions. But it is the 12th episode of our reflection series. And Cecily Hislop is going to be reflecting on episode 118 of the Sports Therapy Association podcast, which was entitled Massage and Manual Therapy, A Modern View, and was recorded way back in 2022 with Paul Coker and Anna-Marie Mazzieri. Just before we bring up Cecily, a big thank you to my guest last week, who was Nicola Smith of Chamomile Health Holistic. And she joined me to reflect on episode 210, Musculoskeletal Health at Menopause, that we recorded in 2024 in August with special guest Michelle Lyons. Nicola in that episode gave me some of the pearls of wisdom that Michelle Lyons is famous for. It's a fantastic listen for all practitioners, male and female, who want to be able to support patients or clients who currently are or could be going through menopause or perimenopause. So that's available, as always, on all popular podcast apps. And if you want to watch the video, then it's on the Sports Therapy Association YouTube channel. Talking of Michelle Lyons, Michelle Lyons will be speaking at the STA Southwest Conference happening in Exmouth this September, the 20th and 21st, in collaboration with the ST School and Hands On Hub. Michelle is going to be presenting on day one, which is Saturday, the 20th of September, in the main theatre, 3:55 p.m., in a presentation called The Menstrual Detective, Why the Fifth Vital Sign Might Be the Missing Link in MSK Health for Female Athletes. It's going to be an amazing weekend of speakers and presentations, including Michelle, also Claire Minshall, Serena Simmons, James Earls, Andy Hosgood, and lots more. All details are available at the stschool.co.uk, along with tickets. I'll be emceeing the 2 days and also delivering a presentation myself on communication with runners. And I'm not sure if you're going to catch the early bird now. Was it 27th we're recording this? I'll try and get this out tomorrow, in which case you've got until the end of June to get your rather substantial early bird discount. Otherwise, what's going to happen is that's going to move into the summer tier, which is still a discount off the whole amount. But hopefully, just consider it. It's not a lot considering the speakers you're going to get. And also this theme we've put together for these 2 days, which really is focusing on you, the therapist, and how all these amazing speakers, the information they're going to give is truly going to reflect in your practice when you go back to clinic. There's going to be a lot of invitations to reflect yourself, to collaborate truly with other people around you, to ask and answer questions that might be a bit difficult for you to kind of own up to straight away. But it's all basically what the learning curve needs to have at the end of a conference in order to retain and make some of that information useful. So I sincerely hope that you do encourage it. That's Exmouth, in collaboration with the ST School and Hands On Hub, on September the 20th and 21st. Right then, let's crack on with this episode, reflecting on episode 118, Massage and Manual Therapy, A Modern View. My guest, once again, re-reflecting, Cecily Hislop of South Phoenix Massage Therapy. I'll bring her up now. Hey, Cecily Hislop, how are you?
Hello. Well, I'm better than last time.
Deja vu, getting a massive deja vu.
The stupid thing is, I don't mind saying this on this live, by the time you messaged me this afternoon, I hadn't actually that long woken up from a kip.
Oh, good on you. That's nice. In the sun, it would seem. If you're not watching the YouTube, then Cecily's got a fantastic Cornish tan going on at the moment.
Yeah. But yes. But thank you very much for doing this all over again, because admittedly I was quite nervous and giggly, but it's such a shame that, I said, we just sort of kept losing each other. And I think there are times just sort of sitting there going, okay, he's there somewhere in the ether, but I can't see him and I can't hear him. Or I think there are times you went very sort of, you were in fast forward. And
yes, I had the same thing in mind. It would have been torture for any podcast listener. So no, thank you for joining me again the next half hour just to reflect on the episode. So For people who, I mean, a lot of people do know you, I'm happy to say, and happy for them because they've met you at
Although,
Therapy Expo, or they know you through the Hands On Hub and the great work you do there online, and at places like Therapy Expo. But for people who don't know you and what you do, could you give us a little idea of where you are in the world and what you do work-wise?
of course, I am, if you want to go by certification, I'm a level 4 sports massage therapist. I am based in southeast Cornwall. Despite the accent, I am actually Cornish, but I just can't, born and raised, but I can't do an accent to save my life. I first trained as a beauty therapist coming up for 31 years ago, and so I spent the first good few years of my working life doing that. So doing the normal kind of spa stuff, facials, massages, body wraps, nails. And then when I moved back to Cornwall 23 years ago, still did it for a little bit, but ended up working in retail for a long, long time. And then after redundancy from one job, I went back and did my level 3, level 4, VT, CT certificates and diplomas, etc. Had a year out because I was fed up with homework, and then did, during COVID, which was fun, reflexology diploma because I felt, as a lot of therapists feel, oh, I've got to have more tools in my toolkit, so let's do something. And also in 2019, that's when I set up the business of 𝐂𝐿.
That's a common feeling, isn't it? That's a common feeling. I need more tools. I've got to do more. Fantastic. How did you get involved in the Hands On Hub and Anna Maria Mazzieri and the ST School and all of that?
Oh, well, I think I was kind of lucky in that regard. I discovered Anna Maria through, funnily enough, SKA podcasts.
That makes sense.
I started watching them, I can't remember if it was 2020 or 2021, but it was certainly around COVID. And I've got to be honest, I'd never heard of the school. Now, considering it's an hour's drive away from me over the Tamar, I had no idea that it existed. Then all of a sudden it's like, oh, actually, there's training that's really close to me. And I'd done a couple of webinars. Certainly one of them was recognising red flags. Another one was, I think it was Eric Purvis's three-part series to do with sort of pain, fibromyalgia. And at the same time, I had done a head shave for charity. And I know we mentioned this sort of last time, so just to give everybody a brief heads up. I also work for an opticians, and sadly, during 2025, so 2023, one of our opticians was diagnosed with 3 glioblastoma multiformes, which are inoperable. And during this time, because it's a family-run opticians, we're very, very close-knit. The boss who owns the practice, Michaela, and I decided to shave our heads and raise money for brain tumour research. We posted it all on our social medias. I think somewhere on my, certainly on my business page, on my personal page, there's a photograph of me with freshly shorn, no head, looking like a proper bother boy. And Anna-Marie had seen it. I think at that point she was possibly following my business page, and she sort of reached out, and that's how I got involved with the Hands On Hub. And I think she liked my posts. For some daft reason she seems to like me, and it's all sort of spawned from that. And then last year she asked me to sort of, I say run the page, but kind of be responsible for posts, sharing things, trying to create content. And it's all just sort of built up from that.
That's fantastic. I mean, I think I said last time, that's so nice. Sometimes I sit here, or quite often these days with my age, I start thinking, where did all the years go? Where did they all go? But when I know that, like with the episodes we were putting out in 2020, whenever it was, I remember the Eric Purves course. I remember. So to think that when that was happening, you were getting to know Anna Maria Mazzieri and developing that relationship, and now where you are now and everything the Hands On Hub is, it's lovely. It makes me realise that the last 3 or 4 years have been well spent. I've got a nice tangible example now in the fact that we helped bring you and Anna Maria together, which is great. It's interesting, yeah. So you're in charge of the Hands On Hub group, which is private, but that's to kind of keep the unsolicited, wanted people out of there. But no one needs to actually, as long as you, as long as you're a soft tissue therapist, you can join up with the Hands On Hub group. Good. And that's interesting because that's a reminder of what we got on next week. In fact, on Tuesday coming up, which is I'll bring it up on the screen for people who are watching on YouTube. We have got a whole episode devoted to Facebook groups, which in theory are set up to support maybe less experienced massage therapists. But there's a topic going around at the moment where sometimes these groups are just there's it's down to communication, I guess. Certain therapists are feeling threatened by some of the criticism, or maybe some of the criticism is badly put, but there's a bit of a conflict going on. So we're going to talk about that next week with a panel. It's going to be two parts. The first part is going to be therapists who feel that they have been treated badly in these groups when they just asked a question and were suddenly jumped on and judged. And that's going to be called Facebook Groups for Massage Therapists, Helpful or Hateful? Bit of clickbait, but you get the idea. And then the week after, we're going to have a few of the more experienced therapists who, hands on heart, will be kind of saying, yeah, maybe I've overstepped the mark sometimes, but it gets so tiring saying the same thing again and again and just seeing our industry being brought down or kept on the same level because of a lot of the misinformation that's out there. So it's really nice to have someone in here now who is kind of, I don't like to use the word policing because that sets up a negative connotation straight away, but looking after one of these groups which provides support for hands-on therapists. But you do it very well. If anything, you're a prime example of how it spreads down. It's like everything, isn't it? It comes down from the leader at the top or the person at the top, and you kind of let this flow of positivity and no judgment and inclusivity kind of run in the group, and it seems to work. So
thanks very
for
much.
that. My pleasure. Right, the exciting question. You had 240 episodes of the Sports Therapy Association podcast to choose from, to reflect on. Obviously, we have Anna-Maria Mazzieri, which might be your answer.
Yeah.
Was why episode 118? Yeah, exactly. And that's why it was. Thanks for reflecting. We'll be back next week. I want a bit of Paul Coker. Now, what was it particularly about episode 118, Massage and Manual Therapy, A Modern View, that made you think, yeah, I want to reflect on this episode from a couple of years ago?
To be fair, it was actually quite hard to choose from. Stevie and Tristan are sort of, because they snuck in there very timely. So we did the episode that I really fancy doing. But when I was looking through, the key thing that stuck out, apart from the fact they're both great therapists in their own fields, they're in the Southwest, and obviously it's the part of the country I live in. But whether it's perception or whether it's knowledge on my part, I always felt for such a long time we seem to be really behind in terms of having specialist therapists, having specialist independent training. So having two people who are at the forefront of what they do in terms of their career. So Anna obviously has, as we know, has the ST school. So they do their level 5 diploma in soft tissue therapy, but they do their sort of webinars and sort of face-to-face courses, from anything that I've mentioned already, red flags to understanding pain to, hot stones. So anything and everything, if you want to use the term a modern massage therapist, is kind of needing, is encompassed, so within her practice and within her training. And then you look at Paul, and obviously I did get to see him last year, part of Therapy Expo. You've got somebody who's incredibly specialised, and whether niche is the right word, in what he does with the vestibular system. And it's great, and it's in Cornwall. I mean, he's certainly not the only Cornish physio you've had on this channel. I mean, you've got Andrew McCauley, Emily, I can't think of her surname, who works for Isla Cell. Again, not too far from where I live.
Emily Sweet, yeah.
Yes, thank you. Yeah. And it's lovely that finally we are getting, and okay, I'll have to include Devon as well, although really slap on the wrist of being Cornish. It's great that this area, which is so often overlooked in terms of business, in terms of money, are now having the go-to people in their fields. And I feel actually really kind of proud of that it's here and it's available. Whereas, I mean, I know the school's been around since 2008. I can't remember how long ago Paul set up. But as I said, for so long, it seems as though it's not been there, and the opportunities. I mean, even when I did my levels 3 and 4, and that would have been 2006, 2008. No, hang on. What am I talking about? 2016 to 2018. Sorry, just sticking 10 years on that. And again, being unaware of what else was out there. And digressing here slightly, even at college, I don't think they're aware of the existence of all these other therapists who provide the training. So to get them out there, to get their names up there and to promote them, to me is just very, very important for our whole MSK community.
That's great. And that's a great bit of reflection to take from, I think, because, I mean, this episode was all about how do we help, massage therapists evolve without kind of making them run away and feel like everything they've learned has been a con and waste of money. And But one of the things is just reaching massage therapists in the first place. And it's great to hear that a show like this has managed to kind of introduce you to people who are on your doorstep who you didn't know about. So it's one of the positive sides of the internet. So that's great. And it's another reason why, I mean, with this conference we're doing in Exmouth in September the 20th and 21st, traditionally we've been in Therapy Expo, which is, when I say we, it's the STA Theatre and the Hands-On Hub. But we realised that for a lot of members, they just can't get to these conferences. It's not necessarily because of lack of money. It's just they can't do it in the middle of the week and travel that far and have to stay somewhere. So we're hoping that conferences like this, we manage to set up around the country so that people can hear about it. And they might not even go to it, but at least they'll hear that someone in their area is on their doorstep and help them. So very exciting. Let's have a look, if we may, about some of the points which were raised inside that episode, which you think listeners might be interested in. You mentioned Paul. I must admit, Paul Coker is amazing. If people haven't heard of Paul Coker, he's been around since dinosaurs. And I'm saying that very kindly. But I mean, people might know him originally from being the kind of medical officer for Rock Tape, I think, back in the day. And so was all of the Therapy Expos, and I met him through the Physio Matters podcast team and everything. But he's a wonderful, wonderful educator. And now he's got Move Physio down in Cornwall and is specialising, like you said, in the vestibular assessment of people, which is something which even 3 years ago was quite, not many people were mentioning it. It's become more popular to talk about now, but Paul is always ahead of his time, always. And he's so quick to defend hands-on therapy. And as a physio, that's quite refreshing, isn't it, to hear?
It is. Again, I'm probably skipping a bit forward, but it's one of the points I really liked about what he said was supporting massage therapists. And let me just remind myself with my notes. He said good manual therapy isn't defined by job title. And again, I think that's so important. I mean, when I did my level 3, it helped me already being a beauty therapist in terms of knowing how to massage people, knowing about my anatomy and physiology. But I came up going, I know nothing about what I want to get into. And I think I was too hard on myself. I wanted to do the level 4 anyway, but I think I was very hard on myself going, well, I can't do this, and I can't do this, and I can't do this, and I can't do this. So what can I do? And so having somebody who saying that, you know what, it doesn't matter where you're at. You can still have the same benefit. You can still have the same purpose. It's, you know, you can have excellent massage therapists or soft tissue therapists who have a great understanding of their clients, who know how to communicate, who know how to listen, who know how to understand. Okay, they might not be able to diagnose or treat in that sort of level, but it doesn't matter because they're still giving the help that they can give to their clients. Whereas I have, through various times of life, seen physios, chiros, osteos who haven't necessarily had that sort of great patient communication. Yes, they're great at doing the kind of clinical stuff, but when it comes to the sitting and talking and listening, it hasn't been so good. But then you can flip that all over again. So every single part of us has a role to play in a person's health. I mean, if we look at another couple of keywords which I brought up, support and community, I've worked alongside a really lovely chiropractor who's based in Bodmin, who actually is my husband's and my father's chiropractor. And, you know, we could often disagree in the staff room about what we're actually trying to do and what we're doing. But at the same time, knowing how patient-focused she is, it was a lovely blend of, you know, I can do this, but I can't do that. So because you're a massage therapist, this is your chance to do what you can do. And same going forward, well, you know, I can massage, I can do a bit of stretching, I can do some METs, but actually I can't do that. And then you can sort of flip it all around, and each of us has a place in our little community.
It's a very good way of looking at it. Yeah, multidisciplinary approach. And Anna Maria said in that particular episode that we kind of consider our skills as what's on the certificate on the wall behind us. But she says, and I'm quoting here, much of our skill actually needs to be to understand the person in front of us and what that person needs and what that person responds to. So like you say, it's listening skills, not jumping out with a solution and working with the individual. And if it means referring on to a more suitable practitioner, that's fantastic. But it may be working with them and you doing your stuff and then doing their stuff. And so, yeah, very interesting. So you a common theme on the podcast is the frustration of when you do kind of CPD and like courses with the SD school, and you discover that some of the stuff you learned originally on your main kind of foundation course isn't quite as black and white as it seemed to be. Some of the things are actually might be wrong.
Yeah.
Is this stuff that you went through, and how did you feel when you heard about it?
Oh my gosh, totally. As I said, because I'm an old school beauty therapist, we learned about the whole shifting toxins, knots in your muscles, and we're affecting lymph, we're affecting blood circulation, we're improving this. And oh god, this is so tragic. But I remember there's a chap who does a lot on YouTube, although rarely now, called Massage Sloth. So again, when I was training, it was kind of picking out bits of information. And I think he did a video about toxins and lactic acids, and I actually just remember shouting at this YouTube video going, why are you disproving this? This is true. Why are you saying this? And you just go, you sado. Shouting at a video. But I think we've got to be open-minded. And a lot, going back through particularly the sports massage training, you're not taught to think critically, and you're not taught to think, is this wrong? And I remember having like a messenger chat with Tristan about this sort of thing 6 weeks ago, going, seeing as I'm the most questioning person there is, and I rarely take anything at face value, I did when I was training. And I don't know why. Whether we think because, as you say, you're paying good money half the time for this training, so you want to be thinking that actually it is correct and what they're telling you is true. And you're right, it is disappointing when you come out and going, and you've got people, for example, like myself and others on Facebook going, well, actually, that's just a load of bull, and it's different. And I'm not surprised people feel that way. And hopefully, with what some of us are trying to do, is just go, okay, this isn't necessarily right, but this is what you can now do to change your perspective, and this is where you can go to learn about the, I don't want to call them new theories because that sounds really insulting, but this is where this is where you can go and actually find the evidence that your training hasn't provided for you.
That's a really nice way of putting it, and I'm hoping listeners who are, for example, maybe beauty therapists or just come out from beauty therapy are kind of thinking, what do you mean that we're not flushing out toxins? And what about the glass of water at the end? But it doesn't matter. Okay, it's something you might slowly take out of your repertoire. There might be tens of other reasons to giving your client a glass of water after treatment is lovely. You don't take that away. It's wonderful. Have those 3 bottles of water, but just don't give them the idea now that unless they do that, they're going to suffer because of this stuff in their body, and it's going to make them feel fragile and weak and all that sort of stuff. I loved it. Who was it? It was actually one of the original Massage Collective people. It was, come on now, who was it? Anne-Marie Matseri, Matt Scar's book, and Becky de Motte-Horton.
Yeah.
Becky, she once said her goal was for every client when they leave her clinic room to feel stronger and more resilient and powerful and empowered, and that's a lovely idea. So it's a good way to think through what you're saying to them. Are you making them walk out powered, or are you making them out thinking, I mustn't do that because otherwise my back's going to slip or my knee's going to come out, and that sort of stuff. So I
once gained a really lovely client when I was working at the chiropractic clinic by telling her, by the time we finished at lunchtime, go home and have a glass of wine.
Yeah, there you go.
I obviously won't go into history, but she had been through a very, very stressful time, she was in the thawing stage of a frozen shoulder. Sort of chiros had done their work. Now it was sort of down to me to kind of finish them and getting her to where she needed to be. And particularly when you're trained as a beauty therapist and you work in a spa environment where everything has got to be absolutely the same and on point. This was our first treatment. I'm just going to say, no, don't go home and drink water. It's lunch. Go home with a glass of wine, for crying out loud. And that's how I gained a client, by going, let's not do the normal tick box and let's not do the normal standard. Let's do something that actually is going to appeal to this person and try to normalise how they're feeling as well.
That's very good. I like that. Yeah, stepping out of the kind of robot stage of I must do this, tick, 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 and let's have a look at the person in front of us and see what might make their day at this moment in time. That's great. Very nice example. I was just going to say, I mean, I came from Swedish massage in TPs in the middle of a park with a very hippie instructor, still goes to Glastonbury, but I credit him for a lot of the empathy and intuition and calmness and patience that I would use with a client. So I'm wondering, you don't look back at the beauty days with regret. Do you think there's lots of stuff you picked up there which is actually making you a better therapist now?
Oh, hell no. I mean, I was really lucky. Certainly at the time, and kind of going back to training in the Southwest, Saltash College, which doesn't exist anymore, I think was the only place in Cornwall teaching beauty therapy. And I was still in my hometown of Bodmin. I wanted to escape and see the bright lights in the big city, so I moved to London. And I was very lucky that my parents were able to pay for me to be privately tutored. And I went to a very posh college called Steiner's. We used to be in Grosvenor Street, right in the heart of Mayfair. And they'd sort of do all the cruise ships. If anybody knows anything about beauty therapy, you'll kind of heard of Steiner's. And I did a year's worth of Monday to Friday, 9 to 5, 2 diplomas, nationally recognised, internationally recognised. We used to have dermatologists from St Thomas's Hospital come and give us lectures. It was that smart. And yes, early 1990s theories are totally debunked now. But we were taught how to present ourselves, how to help our clients, how to listen, how to take our time, how to treat, how to communicate. Absolutely, there is no way. Had I not been a beauty therapist, making the decision to go back and retrain to do sports massage, I don't think I would have done it. Because without that, and I'm not going to rant about training and looking back now, the absolutely huge gaps I think that are in it, because this is possibly another discussion for another day, but I couldn't have done it without that. It taught me so much. And then once I had done my training, I worked in what was a very famous ladies' spa called The Sanctuary, which was right in the heart of Covent Garden. And again, I worked with so many different therapists, not just beauty therapists. We had specialised massage therapists, we had people doing Bowen, we had people doing Pilates. And again, we could all get together, discuss our different styles, if that's what you want to call it, our different teachings, our different learnings, our different understandings. And I've been very, very blessed to have been in that environment. And it's also then why I'm quite so passionate about, again, going back to these Facebook forums and a couple of posts podcasts you're doing further, is why I'm very, very passionate about training. Because looking back on all the training I've done, through all the courses I've done, all the CPD I've done, I've now got a good idea of what is good, what quite frankly is pants, and then what is lacking at what I think at base level for so many therapists. But I'm not going to rant. I'm going to calm down. As I said,
You're not ranting. I think you think you're ranting when really you present a really nice intro and you make people feel relaxed, and then you just tweak it a little bit saying but, and I think it's good. I think a lot of people think that the progression from the stuff we've been taught, which provided a base, which did have a bit of information and stuff which we need to kind of tweak as we start working with people with pain. It's the most challenging thing is just realizing, okay, I've got to change a tiny bit. It's just there's a wall goes up, doesn't it? So
it really does.
But it's not that much you have to change, just a little bit of thinking, and then that opens doors for you, because ultimately you're going to help so many more people and you get so much better results, and you're going to start thinking, oh, thank God, I'm so glad that I listened to that STA podcast with Cecily Hislop. It's brilliant. It's nothing but flowers in the future. Right then, what else from that particular episode did you note down that was worth reflecting on?
Hang on, let's go back to my notes. I'm going to bring back to support and community. So again, this is going to sort of touch it on the sort of social media slightly. But coming back to the STA and their podcasts, I think it was Paul who mentioned supporting community, and as a solo practitioner, it's an incredibly key thing. Also bringing it back to sort of COVID, when none of us really knew exactly what we could do, what we couldn't do. There was so much indecisiveness from the government, and this is not meant to be a political statement, whether you agree with what their actions were or not. We just didn't need to do. And again, that's how I came to find the STA, because at the time I wasn't a member of any professional association. I'd left my previous one because I wasn't happy. I was struggling to do their definitions of CPD. So I thought, oh, blow this. There's no point in me paying my money out. I'm getting nothing out of it. And that's why I bring it back to Facebook as well. I think it's important, whether you agree with what people say, what they don't say, the questions they're asking. It's so important in this MSK community to have a sense of community, to have a sense of support. Whether you're, a young therapist starting out, whether you're as I say, an old bat like me who's been doing this for 30 odd years, we still need to listen and we still need to learn. And for those of us who are more experienced, we can give our experiences. And I think that's really important. Again, I'm not necessarily always right. I am, even after doing this as long as I've been doing it, I am not an expert. If I was an expert, I'd be, quite frankly, living on a Caribbean island doing absolutely sod all day. But you can still learn from each other. You can still learn from the young ones. I mean, to bring this back to the opticians I work for, we have 2 opticians who've been doing this for 30 odd years. So actually, probably together, they've done it for 70 years. And we've got a younger, lovely girl who completely qualified and signed off probably about a year and a half ago. And you can look at it from the 2 perspectives of, okay, you've got people doing this for a very, very long time, but then you've also got somebody who's freshly educated. And there's a lovely medium between the 2 of them as to what they can help each other with, because the younger one can remind the older ones, well, actually, this, and this, and this, and this. And then the older ones can guide the younger ones and go, well, actually, have you maybe tried this? And this is what I found over the years. So community to me is such a big thing. And then to bring it back to the hands-on hub as to why I've been charged and sort of, running it, I think it's important that therapists have a space. Again, I know we've brushed on it, where they can communicate, when they can talk freely. I know I'm asking questions and some of them are sitting there going, oh, God, what's she offering on about this week? But I want to put things out there so people aren't afraid to ask, or, oh, there is somewhere we can get information. So that was a key thing to me. Just sort of bring it back to that.
No, that's very good. It is an overriding theme in there but then again with 𝐬𝐻𝑦 Matsier and everything she tries to do through the ST School, and Paul 𝐂𝐞𝐜𝐤 with everything he's done with 𝑉OCTAPE and with his own private Move Cornwall, Move Physio Cornwall. Yeah, it's not surprising that the episode talked a lot about that. And it's lovely. I mean, this is why the STA is working in collaboration with the Hands On Hub to produce this conference, which I hope is going to be kind of first of a kind. And everything you're talking about, that creator community, is going to be hopefully what happens at the conference. We're going to keep the social evening quite tame, aren't we? You're in charge of drinks table. Make sure that that's all kept very responsible.
I'm staying out of that one then.
Yeah. But it's going to be great. It's going to be really good collaboration. And yeah, because our founder, so Gary Benson, the STA, the reason he set up the Sports Therapy Association was very similar. He was working for other organisations which he felt were kind of like offering membership and then selling courses, and there was just a mixture of different interests going on that didn't work. And his kind of like goal was, I don't want any member to ever feel alone. I want them to feel they've got somebody they can turn to and get support, unbiased, support. So, and now here we are today with 2,500 downloads. People listening to you now, Cecily Hislop. So thank you for giving us your time. So yeah, great. As I mentioned, Michelle Lyons is going to be at the expo. Let's just bring this up for people who do like the pictures as well. If you do see 2 different types of artwork, it's because it is a collaboration. So the STA's got, we've got our artwork here, but you'll see the same kind of thing, but with the Hands On Hub artwork as well. But it's the same conference. And like I say, we've got not just Michelle Lyons, but obviously James Earls, which is a firm favourite. And again, a beautiful educator when it comes to evolving practice, particularly when it comes to anatomy and how we need to tweak the way we look at things a little bit, just to get a better understanding. Also, Dr. 𝐂𝐤𝐢𝐿, we're absolutely thrilled to have along as well, who's a fantastic educator when it comes to bringing the research from strength and conditioning to people who are working on the shop floor. So very excited to have Dr. 𝐂𝐤𝐢𝐿 as well, and loads of other speakers. Andy Hosker is going to be overlooking the coaching and mentoring side of things. So yeah, it's going to be wonderful. And Cecily Hislop will have there as well. You're going to be there, aren't you? Yes.
I will just be the gopher running around like a headless chicken, just doing as I'm asked.
But we always say with these conferences, it's so nice to, I mean, a lot of people have met you at Therapy Expo, which is a fantastic opportunity to network. But hopefully we'll have some people who've never actually met each other and have given each other a hug before as well. Tristan Attenborough will be there giving out hugs. Oh, Tristan Attenborough speaking as well, which is very exciting as well. And Gary Benson. So yeah, there'll be lots of hugs for people who want them, and a chance to really kind of connect.
And he does give very good hugs.
He's a good hugger. Yeah, he's a hugger. It's true. Which would surprise some people in social media support groups. But that's the thing about meeting someone in person. When I first met Adam Meakins, I always say back in 2014, I think, Therapy Expo Manchester, I went up to him. Someone said, "Oh, look, Adam Meakins over there." And there's this guy with like elbow pads. And I went up to him and went, I'm not sure whether to give you a hug or punch you in the face. That was the first thing that came out of my mind. And it was like, huh? I was like, you sound like such a deed on social media. But in actual fact, you're a really nice person. So it was bizarre. But yeah, it's really handy meeting people in person. Well, we'll talk about this next week, but it's so tricky having a conversation with just words. It doesn't work. It's one of the downfalls of the internet. But anyway, we've been reflecting. Hopefully this is going to come out, and this will be the last time we reflect on it for this week.
Actually, can I just say one more thing? I think it's really important. And again, this is a combination of Paul and Anna. Massage therapy will always be here. If the world was destroyed, it's the one thing that will come back. You're talking about hugging. It is that touch, and it is that social interaction. And because it fires up your nervous system, apparently. I'm just reading my notes. And I love that. It's such a basic form of communication was it Greg Lehman said about touching people nicely?
Yeah, I think he used that.
Yeah. And again, it's that whole context of reassurance, calm, confidence, and just sort of bring that to people. And I just thought, actually, as a sort of final statement, I think there's nothing lovelier, because it's not all of us are necessarily massage therapists, but we are touching people as part of our jobs, whether it's a massage, it's a stretch, it's demonstrating an exercise, and it's how we do it and the way that we do it that counts so much and helps people. So there you go. I'll shut up now.
No, it's a very important point. And fortunately, people like Anna Matseri, I think at this moment still are stuck in Sweden somewhere, doing some fantastic research onto touch and what's actually happening under the skin. And we are slowly realizing now, the beautiful thing is, once upon a time we were saying massage doesn't do this, it doesn't do that, it doesn't do that. And we didn't have much to say what it does do. But now when we're looking at the effect on the inflammatory system and everything, then we're realizing that touch has got quite an important part to play. And we're able to kind of back up what we've seen for a long time in terms of it providing part of multidisciplinary care with some actual research, which is very exciting, which I'm sure Anna Maria will be talking about at the conference. Actually, she will be. So, yeah, great stuff. Thank you, Cecily.
No, thank you too. I'm just so glad I haven't lost you.
No, it's great. I'm confident that there's been no spinning or Mickey Mouse kind of language or anything coming out.
You've looked perfectly normal.
And you have too. You have too. Jeez. Wonderful. Right, people. So there we go. We will be back on Tuesday, like I say, with the part 1 of the social media conversation, which will be with people, a lovely group of therapists who feel that people have overstepped the mark and made them feel uncomfortable and made them feel like giving up and all of that kind of stuff we don't want to happen in our industry. And that will be on Tuesday, the 1st of July. If you want to come along and join us for that, which I'm hoping a lot of you do, because it's something where we want people to comment. They said this to me, they did this to me. We want a lot of that for this episode. There won't be any, there shouldn't in theory be any kind of confrontation. It's not like we're mixing a room with people from different sides. This episode is all about when it goes wrong. Okay, if you feel this way, then you feel this way. No one can disagree with that. The week after, on July the 8th, that's when we'll be looking at maybe the other side of the story where, okay, but our intention was to do this and we need to do this because otherwise blah, blah, blah. And those people on the 8th will have had a chance to listen to people on the 1st. And then we might do a follow-up where we get everybody in the same room if I think that's a good idea. But I've still got to see how that goes. But do join us on Tuesday, the 1st of July, 8 o'clock on YouTube. We would love to see you there to get involved in the comments section. So that's it. Well done, Cecily Hislop. Thanks very much again.
Thank you too.
I think we can safely close it down now, knowing that it's going to go out fine. So thanks again, everybody. Hopefully see you
too.
live. Take care. Bye-bye.